We're now in part 6 of our Fastidious gram-negative bacilli lecture. And in this lecture, we're going to focus on the organism Francisella tularensis. So we're going to start out with a case study. A 63-year-old male noticed swelling and localized pain on his left thumb 5 days after he was bitten by a cat. He continued to experience the pain, not feeling so good, tired, fever, vomiting, even though he was taking antibiotics. He was then admitted to the hospital. The physician incised or cut the thumb area and was suspected an abscess. However, no abscess was actually found. 5 days after admission, the patient developed shortness of breath, had a pneumonic infiltrates, and later developed swollen lymph nodes. So the wound culture that grew from that thumb infection was later identified as the organism Francisella tularensis. So there are 2 species of Francisella, but only the species tularensis causes human disease. And there are 4 subspecies or biovars. So there's Francisella tularensis, subspecies tularensis. Francisella tularensis, subspecies holarctica. Francisella tularensis, subspecies mediasia sciatica. And some of these are very difficult to say. Francisella tularensis, subspecies novicida. We just refer to all of them as Francisella tularensis. And Francisella tularensis causes the disease tularemia. Tularemia is also known as glandular fever, rabbit fever, tick fever, and deer fly fever. Francisella tularensis is an intracellular organism. It can reside within macrophages, just like we talked about brucella can. Incubation period is 3 to 5 days, and the classification is based on its site of infection. Also, if there are skin ulcers present and swollen lymph nodes present. So tularemia is more commonly a disease of wild animals. So in 1911, there was an epizootic outbreak of a plague-like illness in ground squirrels. The organism at that time was called Bacillus tularensis, and was called tularensis after Tulare County, California, where the organism was discovered. Humans became infected by direct contact with infected animals, such as rabbits, or through the bite of a vector like a tick or a deer fly. In 1959, the genus was renamed to Francisella instead of Bacillus in honor of Dr. Francis, who first isolated the organism. This, if you want to read this report that was in the Morbidity and Mortality Weekly report. And this is a very interesting case that occurred, tularemia, that was associated with the bite of a hamster. So in April 2004, the Colorado Health Department was notified of a 3-year-old boy with tularemia. So between January 2nd and February 8th, the boy was exposed to 6 hamsters, and these hamsters were purchased from a local pet store in Denver, Colorado. All of the hamsters subsequently died within 1 week of purchase, and what they died from was diarrhea. One of those hamsters bit the child on the left ring finger. 7 days after being bitten, the child had fever, was tired, had painful swollen lymph nodes, and at the site of the bite, the skin was sloughing off. He was treated with amoxicillin clavulanate, but that didn't work. A biopsy of the lymph node, swollen lymph node, was done, and it was suspected that the isolate might be a Francisella tularensis. So this diagnosis was confirmed using polymerase chain reaction, and the serology was done to see the titer, and there was a titer of 4.096 in the boy's serum. The patient improved after treatment with the correct antibiotic, which is ciprofloxacin. Now, workers at that pet store reported an unusual number of deaths among hamsters. However, no hamster carcasses were available for testing, but one of 2 cats in the store was tested positive serologically for Francisella tularensis. So there's a theory of how these hamsters got tularemia. So the wild rodents infected the hamsters and the cats. So there were also some wild animals running around that infected the hamsters and also infected the cats. So the store set traps to get rid of the mice and rats that were running around the store. So the Francisella tularensis infection follows contact with skin or mucous membrane. So the organism, if it comes in contact with the mucous membranes, it can cause an infection. Incubation period is 3 to 10 days. Symptoms are fever, chills, feeling tired, and there are various forms of tularemia. There's ulceroglandular, glandular, oropharyngeal, oculoglandular, pleuropulmonary, and typhoidal. And these forms are based on the entry site. And any one of these tularemia forms can progress into a systemic infection, and tularemia has a 5 to 30% mortality rate if it's not treated. So we'll start out with the ulceroglandular form, and this is a form that follows skin contact where you get ulcers at the site of the infection. The regional lymph nodes, or the lymph nodes in closest proximity to the site of infection, become swollen and painful, and they may drain. And this is the most common form. The ulceroglandular is the most common form of tularemia, and it is very rarely fatal. The glandular form follows skin contact. Usually there's no ulcers that you can see, however the regional lymph nodes do become swollen. In typhoidal, this is the type that follows ingestion of the organism, and it leads to abdominal symptoms and can also lead to a very prolonged febrile illness, very similar to typhoid fever, where the person is, feverish and just doesn't feel very well, kind of tired and achy for a very long time. Oculoglandular follows inoculation into the conjunctiva or eye, which causes a very painful, pussy conjunctivitis, and it can also cause swollen and painful lymph nodes. Pneumonic is the worst form of tularemia, and this follows inhalation or from other sites of the body, like the blood, it can get into the lungs. And this is the contagious form. So contagious is when an organism spreads from one person to another person. So tularemia is contagious. It normally resides in wild animals such as rabbits, which are the most common, squirrels, muskrats, beaver, deer. Animals may not be symptomatic. It can also get into the wood tick, which is a reservoir for infection. And in the wood tick, the tick can passage the organism through transovarian passage from one generation to the next. So here's the geographic distribution. In the United States, we have more commonly type A and type B. Now again, we said direct contact with infected animals is the most common, is a route of transmission. Hunters, people that might be skinning infected rabbits would be at high risk. You can also get infected by a bite or a scratch from an infected animal. In the northwest and midwestern region of the United States, it's commonly transmitted through tick bites. In the southwestern United States, it's transmitted through deer flies. And most cases that are reported in the United States are through ticks. So safe practices when handling potentially infected animals is a way to prevent and control infection, wearing gloves, eye protection, thick gloves where if an animal were to bite you, it wouldn't penetrate the skin, promptly removing ticks from your skin if they're attached, thoroughly cooking rabbit. You never want to cook a raw wild meat that might be infected. There is a vaccine for laboratory workers that are at high risk. However, it's not a commonly used vaccine. Military personnel may get vaccinated just due to the fact that Francisella tularensis is a bioterror agent. In where I worked, because I worked on doing research on bioterror agents, we did not get vaccinated for Francisella tularensis. It's an experimental vaccine. It's not an FDA approved vaccine, so we weren't required to be vaccinated. It's a very difficult organism to control because there's so many wild animals, and the fact that it's in ticks and flies, deer flies, so it's very close to impossible to control infection. So we're going to talk about lab diagnosis of Francisella tularensis. And the specimen types are going to vary. It can be an exudate from a skin lesion. It can be an eye or conjunctival scraping. It can be an aspirate or drainage from a lymph node. You might do a direct exam, so you can do fluorescent antibody staining. You can use the light microscope, although all you would really see if on a gram-stained specimen is a gram-negative rod, so it may not help you know that this is a Francisella tularensis. Possibly combined with clinical symptoms and history, maybe, but you need a little bit more than a gram stain for Francisella. So culture and biochemical staining is dangerous. This is an organism you need to work on in a biosafety level 3 laboratory. Under the microscope, the organism is gram-negative, pleomorphic, teeny tiny rod that shows bipolar staining. So, this is an organism that if it were in a clinical specimen and you didn't know it, you'd hopefully be working on the clinical specimen under a biosafety level 2 cabinet. Once the organism is growing up on a plate and you were to do some tests on it, the second you thought it was a Francisella tularensis, again, just like brucella, it would be reported to your local health department. The specimen would then get sent off to the health department, to CDC, because of it being on the list of bioterror agents. So this organism is highly pleomorphic. You can see teeny tiny rods, you can see long filamentous forms, and of course it's gram-negative. It takes 2 to 5 days for the organism to grow, and it doesn't grow very well on your 5% sheep blood agar plates. It prefers to grow on chocolate agar as minute, transparent, very tiny little colonies that look like small little drops. It does not grow on brain heart infusion agar or tryptase soy agar, and like I said, it doesn't grow that well on blood agar. You can get that greening underneath the colonies, but that can make it look like it's alpha hemolytic. So if it were isolated in the lab, you would automatically notify the public health authorities. If it were suspected, if a physician were to see a patient and the patient had the history and symptoms, the lab should be notified to be very careful and to be on the lookout for Francisella tularensis. So it doesn't grow on or grow well on your typical sheep blood agar. It requires sulfhydryl compounds such as glucose cysteine agar or GCA agar. It requires enriched media, defibrinated rabbit blood. It needs thymine, and chocolate agar that's enriched with cysteine. It will grow on our commercial chocolate agar. It will form smooth gray, like I said, looks like little drops, little pinpoints, and it usually is slower growing. You can get colonies showing up after overnight growth, but in order to really see it, it takes a couple of days. So here is Francisella tularensis, and this is after 72 hours. And this is a chocolate agar. So absence of growth on your typical 5% sheep blood agar and growth on chocolate agar might be an indication. Slower growing, taking a few days to grow on media, having bipolar staining, so staining darker on the two ends than it does in the middle. You can do fluorescent antibody staining and agglutination testing. And here's a chart of your fastidious gram-negative rods. If it's a zoonotic organism that's catalase positive and indole positive, you might be thinking of Pasteurella. If it has special growth requirements, it needs cysteine, you'd think Francisella. You might consider your Hayseck organisms, your Legionella, your Bordetella, your Capnocytophaga. So this is just an overall flow chart. It doesn't have a lot of specifics in here. We're going to move on to the 7th part of this fastidious gram-negative rods.